introduction, she is really one of the leaders of immunology in France and globally indeed. She's Professor of Immunology at the Pierre et Marie Curie University and Chair of the Immunology Department at the Pitié-Salpêtrière Hospital in Salpêtrière. Pardon my French, in Paris. I know you were at the workshop yesterday as well, and what are your thoughts about all of this and where it needs to go next?
So thank you very much, and sorry for having such difficult names, Pierre et Marie Curie, Pitié-Salpêtrière. So I'd like to thank all the participants to the workshop we have organized yesterday, and thanks to BIOVISION organization who provided us the opportunity to gather very important experts in the field. So perhaps I may have the next slide. We gather indeed. Next slide, please. Well, so we were happy to gather experts in the field from France, Europe, and happily from international aspects, and particularly we had Jorge Khalil, who is directing the Butantan Institute in Brazil, and we benefited from the participation of Dr. Ruxandra Draga-Akli and Dr. Sergey. So with these experts, next slide, the aim of this workshop was to try to complement the excellent roadmap that has been prepared by iProve and to which most of us have indeed already participated. And we wanted to add some important aspects to complement, as I said, this roadmap, and particularly to focus even more on what should be emphasized if we want to accelerate vaccine innovation. And first, we agreed that we have to distinguish several entities. Vaccines that have to be built for emergency purposes or against orphan diseases or for other unmet medical needs. And we need that to do that, to accelerate vaccine innovation, we need to develop a global health perspective first, and a One Health perspective. We need to change our ways to develop vaccines, and particularly at the clinical clinical development level. We need to incorporate more what is now called big data, and particularly to facilitate access to existing data on clinical trials. But more specifically, we wanted to emphasize the fact that indeed we want to maintain the European leadership in vaccine development, but we have to work internationally. We are a global community, and there will be no definitive solution for any vaccine if we don't have a global perspective. Then to accelerate vaccine innovation and vaccine implementation and vaccine availability, we need to reinforce infrastructures, and particularly here in Europe. So Dr. Ruxandra Draga-Akli told us that it's done with the European Commission for Research. We have already a federation of big infrastructures to test and develop new vaccines. However, we need to federate those infrastructures, and we need to facilitate access to these infrastructures in order to facilitate and accelerate vaccine innovation. Certainly also we need to increase the number of European facilities to produce vaccines, either at the academic level or I would say non-profitable level, and at the industrial level to fulfill all the needs of the populations and to be capable to provide enough amounts of vaccines rapidly. So on the next slide, we insisted on the necessity, as it has been already discussed today, for developing a partnership, public-private partnership. And we would like to call that the public partnerships, but private-public partnerships of interest. Having said that, it's important to mention the problem of the conflicts of interest, because all of us agree that we will never develop any vaccine without a PPP, as I agree. We have to face the problem of conflicts of interest. And the only way to solve this issue is to add more transparency at this level and at all levels of vaccine development. When you conceive a new vaccine and when you develop a vaccine, we need to be more transparent and to include the civil society. Although nobody has clues to how we have to include the civil societies. Another point which is very important for vaccine development is to facilitate SMEs development and involvement in vaccine innovation, because innovation is coming from SMEs and SMEs have to be encouraged. Another aspect, almost final, is the regulatory aspect. It has already been mentioned. We need to develop a science of regulation. We need to interact more with the regulatory agencies. We need to work with them at very early level, and particularly to rethink the design of clinical trials. We have to take the model of the Ebola vaccine trial that has been performed by MSF and WHO, the ring vaccination. That was the only way to provide the kind of evidence that this vaccine was efficient. And now the regulatory agencies have to take into account this new design and to accept this design to authorize this vaccine or other future vaccines. We mentioned the question of human challenges. We have also to think of mixing more phase 1 and phase 2 trials to de-risk vaccine innovation and clinical development. And last but not least, on the next slide, we have to face the question of vaccine hesitancy. And the only way to face the vaccine and to try solving the question of vaccine hesitancy is education. Education at all levels, education and training of the professionals in biology, in the academia, for healthcare workers. But we do think that we need to discuss and educate more the civil society. We propose to introduce early education, early information at primary school, at high school, as part of a general education on prevention, not only on vaccines, but on prevention. We have to incorporate more the notion that vaccines are part of prevention facility, as we have in France sexual education to prevent pregnancies. We need to educate to prevent infectious diseases. And of course, we need to, not to educate, but to inform the media and the policymakers. Thank you very much. Thank you to all the participants.
Can I just ask you one question, actually, on the vaccine hesitancy issue and the concept of vaccine injury and vaccine safety? Vaccine injury is a real phenomenon. It occurs usually, though, at a very, very low frequency, and the risk-benefit is more or less always in favour of the vaccine. And I'm very clear about that. But there have been issues with, say, narcolepsy and a certain pandemic flu vaccine, the Guillain-Barré syndrome, I think as well, possible risk there with some or other. I can't remember exactly the sources I've been reading. They have been proper, scientifically valid sources, though I would. Does the industry need to be a bit more upfront about that? Because that conversation tends to be sort of kind of kept down, and people say, well, the risk-benefit profile is always good, so don't worry about this stuff. Like, these injuries do occur, and that's why, and I know that the risk of, say, a child getting mumps is far higher than them getting some bad reaction to the MMR vaccine. I know that. But if a mother says, well, if I can rely on herd immunity, why should I expose my child to a 1 in 5 million risk of something bad happening?
So, of course, the industry has to be more upfront, but industry cannot be alone in that field.
True.
It has to work with the academia. It has to work with the medical doctors. It has to work with the civil society. And we have to find ways to better analyze the mechanisms of these extremely rare vaccine side effects, which are usually not directly linked to the vaccines, but to the components of the vaccines, which are also included in pathogens.
And maybe the genotype of the recipient, maybe? I don't know.
Well, I'm not a believer of this approach, but perhaps it will be one approach. But certainly, it's another example of public-private partnership.
Yeah, it's complicated. Thank you, Brigitte.